Johns Hopkins Hospital sent African-American Henrietta Lacks cells to be studied without her consent. Researchers found that Miss Lacks' cells could survive and reproduce indefinitely. Miss Lacks' mortal cells were used to study polio, tuberculosis, salmonella, HIV, Ebola, and most recently COVID-19. Over 100 corporations today use Henrietta cells to create medicine. Despite changing the course of modern medicine forever, Henrietta and her family never received so much as a thank you, much less a financial package. The Tuskegee study was an experiment promising you to help patients of syphilis. In reality, the study studied what syphilis would do to the body naturally. This study was a government-funded ordeal and was lasted for 40 years. The study took advantage of the town of Tuskegee and hundreds of its poor, illiterate blacks. Still one of the most egregious displays of racial disparity in healthcare. I remind you of our history to present the biggest issue facing black health: black distrust in the medical industry. Historical mistreatment of blacks in the healthcare community has caused African Americans to not trust their healthcare providers. 41.7% of African Americans do not trust a doctor to explain their research participation. Similarly, 45.5% believe that their physician would expose them to unnecessary risk. African Americans no longer believe in their doctors, and this mistrust only goes on to hurt the black community more. Black patients are already more likely to develop chronic disease or die of asthma and cancer than their white counterparts. This distrust has led to 2 to 3 times as many black people dying from preventable disease than their white counterparts. Fortunately, we cannot say that their distrust in the healthcare system is unwarranted. Even today, the KFF and the undefeated polls have found that 19% of African Americans reported that they were turned down for a test that they believed they needed. 22% said that the healthcare providers didn't believe that they were telling the truth. These people still experience racism in the medical spaces, and even worse, it's still taught. 40% of first and second year medical students believe black people have thicker skin, could handle pain better, so black people are 22% less likely to receive pain medication. As much as we'd like to believe that racial discrimination in the medical field is a thing of the past, studies have shown time and time again that it continues to hurt black people. We need a solution. Luckily, studies have shown that people feel more comfortable with a doctor that looks like them. One study showed that black men receive better care with a black doctor, and another found that people are more willing to recommend doctors if they look like them. Our history has been tainted, but we can build a future where African Americans can trust our healthcare system.